This is Lwengo Health Centre IV. For a patient coming to a government health facility, the expectation is simple treatment, dignity and care. But at Lwengo Health Centre IV, residents say even the basics have become a daily struggle. At the facility, water has become another burden. A number of patients say they can spend days without bathing because they cannot afford to buy the water. A 20-litre jerrycan costs between 1,000 to 1,500, yet they are already faced with financial burdens.
Kubanga tewali mazzi wetugajja n'eddamu eri wala obona okutuuka ekiwangala gye wava amazzi etukozesa akati tukigula 1,000 ate nga nago mabi nnyo ga bisooto ttaka butaka. Naffe bennyini abali mu ddwaliro wano tuleeta abaana nga balwadde twetaaga okwoza twetaaga okunaaba naye omala wano ennaku 3 nga tonaaberwa amazzi ng'olowoozaamu ogula ekidomola ekyo1,000 nga bikusobedde kati obwabeera nga mwavu nga talina era mulimu abatannaba kunaaba be nasangawo nnaku 3 n'okweza tannaweza agamba amazzi n'onsanga nga oluusi n'akamere talina. Tulina amazzi tulina mu butuufu obuyambi bwonna bwe tusobola okufuna. Batambuza amazzi ne tudda ku luguudo ne tugalinda ne tugula kidomola kya 15 wano nkuba erugeo butono nga tugafunawo mu ggoonya mataaka.
The leadership at the facility acknowledges the challenge. They say the gravitation water reaches the health centre twice a week, despite the large population it serves.
We actually, because of the long dry spell, we don't have piped water in this facility. So we rely on a water bowser that brings water here twice in a week. And it brings 8,000 liters at a go. So, and yet the need for water is very high. But as I was meant to understand, the in charge is not here, but every 2 days of the week, at least twice, they bring 2 bowsers here. And we lack piped water here, national water.
As for mothers who have given birth to premature babies, they are required to carry their babies closely to their bodies in a kangaroo style. Minister Anifa Kawooya cautioned the practice. Health workers explained that kangaroo mother care is an established approach for caring premature and low birth weight babies.
I will not accept a facility that there is no standby generator, the premature babies to be in the incubator. You are telling the mothers to go outside on the sun to get the natural heat. Bamama n'obwana babagambe mugende mutule mu musana kati singa kanako.
Nowadays we recommend kangaroo mother care, so they have to have their babies close to them for warmth. So they have the babies here because we are practicing kangaroo mother care, not because the machines are down. The machines are working.
During the minister's abrupt visit at the facility, patients told the Minister Kawooya that the facility frequently runs out of essential medicines, leaving some with prescriptions to purchase drugs elsewhere. Inside the wards, another problem is difficult to ignore. The pressure on the facility is also growing. It serves patients from several villages in Lwengo District, putting additional strain on its limited resources.
15 to 20 years. Lwengo Health Centre IV has not been having water. One, why the ministry upgrades facilities, that there must be entities available. And I am sure it was on that basis that Lwengo Health Centre III to move to Health Centre IV, it has got water. That is number 1. Number 2, cow. Why haven't you initiated to ensure national water. Cow and your chairpersons of all those 20 years, not even this year, or who came. Why haven't you initiated that Lwengo Health Centre IV has got water?
But during the inspection, Minister Kawooya demanded answers from the facility leadership over the concerns raised by patients.
Why is it today that even the patients are the ones saying, tell the minister we don't have water? Cow, why do you tell me you rely on rainwater? You answer. For 20 years, why haven't you, as Cow and the district, initiated to have water into this facility?
The district health officer was tasked with ensuring patients receive the services they are entitled to.
Water to this health center for Lwengo
on a daily basis.
On a daily basis. Daily basis. And the water that is delivered must be recorded and monitored, and the RDC must take it upon himself. I have been working with your Member of Parliament, District Woman Sise Namuji. I am aware that even some transformers in some places were abroad. Why didn't you ask for transformer for this? There is an issue of mismanagement here. RDC, I am writing an official letter to the Minister of Local Government. This is pure negligence by the staffs at this service facility.
Lwengo Health Centre IV has been serving this community for more than 2 decades. For the residents of Lwengo, better healthcare is not a privilege. It is a right they believe should begin with a basic medicine, water, dignity, and safe conditions for every patient who comes seeking for help. Helen Barbara Jizamba, Prosichon Tawaire, for UBC News.